In fact, just discussions with my CDC colleagues yesterday, who were talking about the CDC is looking at doing a study of seeing whether or not two masks might be better than one. It makes common sense that you would think. And the reason they don't recommend it right now, it's a science-based organization, the CDC. They make recommendations based on data and science. So that's the reason why they're going to look at that particular issue. But the reason why many people are using double masking, and in fact, you probably have seen me wearing a double mask, is that you can make a general common sense extrapolation. If one mask serves as a physical barrier, if you put two on, if you're looking for enhancing the physical barrier, it makes common sense that it certainly can hurt and might help, but it doesn't yet reach the point of an official recommendation from the CDC because of the lack of data. But when people tell me or ask me, should I be wearing two masks? I say, if it makes you feel better to do two masks, the chances are you're going to get an enhanced protection. So why not go ahead and do it?
Let's talk for a minute about challenges in the distribution of vaccines. As of Sunday, the CDC said that about 25.2 million people have received at least one dose of a COVID-19 vaccine. About 5.7 million people have been fully vaccinated. I'd be curious, as a scientist, as a researcher, what kind of grade would you give our performance in getting these vaccines into people's arms? Are we doing a B job, a C job, an A job? What do you think?
Well, I would take it one step earlier to get the big picture, David. I think when you talk about developing the vaccine and getting a successful vaccine, that's an A triple plus on that. I mean, that is record-breaking, 11 months to do. Getting them produced, obviously, that's good. But you're right, getting them into people thus far early on, when it was tried at the end of December, got a bit of a shaky start in the sense of the logistics of that, something new in essence, taking on a task that has not been done before. You're right, it has not been perfect. And one of the things that President Biden has made very, very clear, if that things are not working well, don't deny it, don't run away from it, try and fix it. And that's exactly what we're trying to do. If you look at the national strategy for COVID-19, part of that is try to expedite the distribution. And that would be in the mind of all of us on the team, a much better collaboration between the federal government and the locals, particularly the states and the cities. The federal government's not going to fix this alone, nor are the states going to do it if you just leave them on their own without any help. What that's going to be is a cooperation and a collaboration and a synergy between the feds and the states, but also the rolling out of community vaccine centers to make it easier to get it done in mass. Number two, to get the pharmacies much more involved. Number three, to use mobile units to get out into relatively inaccessible areas, particularly concentrating on the concept of equity, to get particularly minority populations who may not have as easy access to the vaccine to get that done. All of that is being implemented now. And I believe, David, that you will see in the next few weeks a much bigger escalation of the capability of getting vaccine into people's arms.
And I take it this will be federal government led. You'll be working through state and local authorities, state and local pharmacies, et cetera. But it's going to be led now from the center, from Washington.
Right. Exactly. You're going to see much more involvement of the federal government in assisting than we saw in previous months, where the states, in so many respects, were left on their own. We got to get a synergy between the feds and the states, particularly some leadership by the federal government.
Let me ask you briefly about the priorities for who gets vaccines. In the closing days of the previous administration, an order went out that people 65 and over should be in the next tranche of eligible people after healthcare workers. That's been implemented in some states, some counties, not in others. It's a little bit of a hodgepodge. But in terms of the basic science and medicine, do you think that makes sense now to have 65 and older be the next benchmark across the country?
Well, it depends on where you're starting from. I mean, the first benchmark, David, was people who are the healthcare providers and those in nursing homes and those taking care of them. And then you went to 65 or 75 or older was the first one. And then individuals who are having essential jobs in society, such as teachers. I think that's reasonable to bring it down to 65 and older. I think is a reasonable adjustment of that. What we're looking for right now, as you get into the groups that have a much, much larger proportion of the population of the United States, that would hopefully be at a time when you get much more higher numbers of vaccines available. And as we get out of February into March and April, you're going to see a major escalation of the number of doses that will be available. So I think we're going to be able to accommodate them. When you get into a group where the demand within a group exceeds the supply, that's when you have to be very organized in how you roll that out so that you don't have people expecting that they're going to show up and get vaccinated and you run out of vaccine, or you have inordinate lines and people waiting. If it's done in an organized way so that people can get a good prediction of when their dose would be available, that's what we're striving for.
And what about the problem of vaccine hesitancy or resistance? There are folks who just don't want to take that shot. Other countries have got pretty aggressive programs to deal with that problem. What about here? Are you and your colleagues thinking about some way to speak more directly to the public and say, you need to do this?
You know, David, we're not only thinking about it, we're investing an awful lot of time in that. I would say without hyperbole that a day does not go by when I am not out there in some form of outreach, as well as so many of my colleagues, particularly in underserved populations, spending a lot of time with Black churches, Black religious group, brown and Black leadership groups, to be able to talk to them and explain to them why it's so important for them and their families to get vaccinated, not only for their own safety, but the safety of their community. So there is a concerted effort, which is considerable in the sense of individuals as well as a group. So that's something we take very seriously because, as I mentioned earlier on in our discussion, if you want to prevent the evolution of mutations, you've got to get as many people vaccinated as quickly as possible. And if you have vaccine hesitancy or reluctance to get vaccinated, you're never going to get to that overwhelming majority of the population, which I've estimated should be at least 70 to 85% before you get that blanket or umbrella of what we refer to as herd immunity, which if we do get that, there will be very few mutations because a virus is not going to mutate if it doesn't have a playing field to replicate. So vaccine hesitancy is critical, and we are addressing it.
So, Dr. Fauci, given some of the issues we've been talking about this morning, including delay in distributing vaccine in the U.S., we haven't talked about abroad, but the problems the same there. Do we need to begin to revise our timetables for when this problem is going to be behind us? The Wall Street Journal just ran a story with a headline, "Vaccination Delays Put Global Rebound at Risk." And they noted that one of the Swiss banks has said only 10% of the world will be vaccinated by the end of this year and only 21% by the end of 2022. And let me just ask you in conclusion to address this, the question we all have, which is, when do you think for us here in America, life's going to get back to something like normal? Is that September, November? Is it next year? What do you think?
You know, David, it's a great question. Everyone asks it, but they have to be estimates that have contingencies. You cannot give a definite answer when you have so many moving parts. So let me explain what I mean, because I think it's important for the American public to appreciate that, because when you give a definitive time and it doesn't work out, they say, the scientists were wrong, they gave us wrong information. It depends on so many factors. If you have the overwhelming population, let's say up to 85%, get vaccinated in a very efficient way, so that as you get into the summer, you've essentially vaccinated most of the people you need to vaccinate, be that 280 million or 300 million. By the time you get to the end of the summer, you have them vaccinated. You're going to approach some degree of normality as you get into the fall. But you got to say, however, and I want to underline however about 5 times, David, because there are a lot of things that could get in the way of that. For example, we were talking about several of them. If we get a real problem with the mutations and the vaccine is not as effective and we don't address it by upgrading the vaccine, that timetable could change dramatically. Number 2, if you have a degree of vaccine efficacy, a vaccine hesitancy, then you have another problem, because if you're striving to get 85% of the people vaccinated and you only get 50% of them vaccinated, then all of a sudden the timetable goes out the window. So you get mutations you got to deal with, you get vaccine hesitancy you've got to deal with. All of those things are going to determine. So anybody can make a reasonable prediction of when we're going to get back to some form of normality. But I think the American public have to realize that that's always contingent on certain things going right. And if they do go right, then the numbers and the dates that I mentioned will be okay. One final thing that you alluded to just a moment ago is that we live in a global community. And if we really want to talk about true approaching normality, then we've got to attack this at the global level, which is the reason why the programs like COVAX, which is a consortium of countries which we've recently joined now as President Biden became president, which means we're going to help out with other developed nations and other organizations like Gavi and CEPI and others to try and get as many people in the globe vaccinated as quickly as possible. Because whenever there's transmission and viral outbreaks throughout the world, the United States will always be in danger, no matter what we do. So again, all of these things are contingencies, David, that will then get us to normal, but they've all got to fall into place. Otherwise, it would be really unpredictable when we're going to get back to what we all want is what it was like before this happened, namely normal existence.
It's a good point to end it on. The more people get vaccinated at home and abroad, the safer everybody's going to be. I want to thank Dr. Anthony Fauci for being with us for this half hour. It was so informative, so helpful to all of us. Thank you, Dr. Fauci.
Thank you, David. I appreciate you having me on.
So live this afternoon, please join us for Congresswoman Val Demings. She was a presidential candidate and an impeachment manager last year when President Trump was first impeached. I'll be back tomorrow for an interview at 1:30 with UN Secretary General Antonio Guterres, which will be an interesting chance to look at the world from the eyes of the person running the United Nations. Thanks so much for joining Washington Post Live.